Distinguished guests, ladies and gentlemen, Minister for Health, Bulamenak, and a very good morning to you all. Ladies and gentlemen, it's my great pleasure to join you all here this morning to officially open the new Nakasi Health Centre, a $6.7 million facility that will raise the bar for medical care in Fiji. Years in the making, the Nakasi Health Centre will change the face of health centre for tens of thousands of Fijians who will utilize its services. The many neighbouring communities who visit the facility, extending from Narere and Makoi to Lokia, Davuilevu, Wainbuku and Waila, will make this investment that will pay off for decades to come. The quality of this facility and the many services and treatments that it will offer will continue to fuel Nakasi's status as the bustling hive of activity. The manufacturing jobs and retail that the area currently offers will be joined by excellent medical care as the reason that Fijians from Davuilevu, Narere and Makoi are attracted to this growing hub of the Suva suburbs. New developments, from schools to roads to health centers and even an expanded airport, the Suva-Nosori corridor is quickly proving to be an epicenter for Fiji's rapid transformation into a dynamic and modern economy. Each time that I drive through this area on my home from the airport, the hum of construction seems to grow louder, and it seems like every other activity that I'm coming back to open a new development or break ground on another $1 million project. A feeling that never gets old when I'm surrounded by you, the many faces of those whose lives will be directly impacted by the many fruits of our flourishing economy. And few developments truly show how far we have come as a nation over the past decade as much as this one. Staffed by 2 doctors and over 8 nurses, the Nakasi Health Centre will offer many advanced treatments and house state-of-the-art equipment for treating a variety of ailments and conditions. It's a latest landmark project in my government's huge capital injection into our medical centre, all across Fiji, from Banga to Dubu to Singatoka, from Lotoka to Watukarasa to Nangatangata to Makoi. We are operating new and upgraded health centres to offer more services to more Fijians closer to home. And at CWM, a maternity ward expansion and upgrade at a cost of $11 million that's currently under construction will bring women's health in Fiji up to international standards, expanding the number of beds to 200. It will be equipped with anything that a mother would expect in Australia or New Zealand. And we aren't stopping there. We have grand plans for new hospitals in Ba, Rotuma, and Nabosa at a further total investment of over $70 million, which will continue our ongoing transformation of Fiji's healthcare landscape. And we're not just investing in the buildings themselves. My government's approach to overhauling medical care in Fiji is holistic. And it starts with making sure we have the necessary staff and equipment to fill these walls with the tools that Fijians need to live longer, healthier lives. That mission is what is constantly driving us to find new and innovative solutions. Thanks to the latest national budget, the Ministry of Health and Medical Services is now undertaking a wide-reaching investment in our human capital that rewards those Fijians who are the lifeblood of our healthcare sector. The number of doctors and nurses in Fiji has doubled under my government, but we aren't stopping there too. We are actively recruiting more doctors, providing our community health workers with a $200 monthly allowance. And we have increased the salaries of our existing essential healthcare workers by significant margins. In fact, thanks to our ongoing civil service reforms, doctors and nurses have already received huge pay rises of 80% or more depending on their grades and positions. And we are looking outside the box to continue this momentum and provide the best and most affordable care to Fijian families. We are currently pursuing public-private partnerships to find international partners to upgrade the Ba and Lautoka Hospitals to world-class facilities that provide new and complicated treatments like open-heart surgeries, which Fijians used to have to travel abroad to receive, right here in Fiji, all at no additional cost to patients. And we've expanded the free medicine scheme to families earning below $20,000 per year, while also subsidizing the cost of dialysis treatments to make even the most expensive treatments accessible to every Fijian. All said, Fiji is in the midst of a healthcare revolution, and every man, woman, and child in our great nation stands to benefit. Friends, when it comes to the construction of a facility like the Nakasi Health Centre, far more goes into a project like this than meets the eye. The many stages of careful planning involved before the building foundation is even poured are often more painstaking and complicated than the physical construction itself. After we determine that a government project is needed, in case such as this, a suitable plot of land must be identified, purchased and surveyed, the best contractor for the job is sought out, and extensive engineering and design work takes place. Once the site is cleared and the land is prepared, the soil needs to be given enough time to fully settle before any of the hard labor can begin. If any of these critical steps are skipped over or rushed, we all know that the foundation may crack or the walls may sink. And it's like the famous, everyone's quoting from Bible readings now, mine is very simple. It's like the famous story of the wise and foolish builders. The man who built his home on sand watched helplessly as it was destroyed by wind and water. But the man who built his home on rock enjoyed the stability of a foundation that was made to endure any storm. In this sense, ladies and gentlemen, excuse me, the Fijian economy is no different than the story of the wise and foolish builder. Excuse me. Right now, we are seeing our economy thrive more than any point in our nation's history. Unemployment is a record low, and as we near a decade of unbroken growth, the signs of progress are undeniable, and they are everywhere. Schools, hospitals, and private sector developments are popping up at a remarkable rate. This streak of success isn't by chance or coincidence. It's the result of very careful planning that has been spearheaded by my government's visionary leadership. And we never go in it alone. However, we know that no government is all the solutions, and we want to build our economy on a rock-solid foundation that will last for generations to come. That's why, with every decision we make, we go through extensive consultations, taking the perspective of all stakeholders into account. In the weeks before an election, it's no surprise to see desperate politicians making irresponsible and reckless promises in an attempt to confuse the public and earn a few votes, all without considering the economic consequences of their actions. They claim that the minimum wage can be suddenly and drastically raised, despite business owners telling us that such a move would result in the death of entire industries and the loss of many thousands of jobs overnight. Putting policies like this into place without consulting stakeholders or taking the advice of experts who conduct thorough studies like my government has done would be like building the Nakasi Health Centre without blueprints on soil that has not settled. Let me be clear when I say that the foolish and haphazard approach to running the Fijian economy would end up like a house built on sand. It would be a disaster, and it would result in the destruction of everything we have worked so hard to build. All of our accomplishments earned through responsible growth and prudent economic management risk being washed away at the hands of foolish grandstanders. Like them, my government will never make promises that it cannot keep. The stakes are far too high to mislead the Fijian people about what is possible just for the sake of winning votes. The truth is this: as the economy continues to grow under our leadership, the minimum wage will continue to rise at a rate that is sustainable, thoughtfully considered, and not pulled from thin air and artificially imposed by an overreaching government. While the opposition will try to falsely take credit for any rises that may happen, they are quick to ignore that this has been our plan all along. As you know, the Minister of Economy announced in this year's budget the national minimum wage is being reviewed and will continue to be reviewed on a regular basis so that all wages, including those across the 10 different sectors where wages are set above the minimum wage, will be adjusted in a way that achieves both fairness for working Fijians and stability for the economy as a whole. Because while previous governments have driven the Fijian economy into the ground, my government has proven that we know the formula for economic prosperity. Prosperity that has resulted in new health centers such as this, expanded medical care, and universal primary and secondary education. Prosperity that resulted in unprecedented tertiary loans and scholarships, upgraded airports and roads, free-to-air television, and sustainable jobs in new and exciting industries. Prosperity that has resulted in Fiji entering into a new era of development, one that on our current path will stand strong on a foundation of rock for many generations to come. Ladies and gentlemen, it is with great pride that I now officially open Fiji's latest development and the latest delivered promise for my government, the Nakasi Health Centre. And I look forward to opening many more like this in the years ahead. God bless you all.
I'm truly delighted to move the vote of thanks to our Honourable Prime Minister for officially opening our new health facility in Nakasi here this morning. Honourable Prime Minister, thank you indeed. Thank you very much indeed for gracing this occasion here despite your busy schedule. And we are immensely inspired by your address conveyed here today this morning. So your presence here today reflects on your leadership and the commitment of the Fijian government in the provision of quality healthcare services with the availability of enhanced health services which will cater for the sick and the suffering population of the nation. On behalf of the Ministry of Health and Medical Services, I would like to sincerely express my appreciation also to the residents of Nakasi and nearby communities. Thank you very much for your cooperation with our ministry, which has indeed been very crucial and motivating in the undertaking of this milestone initiative to uplift the health services for your population here. We wholeheartedly thank you for your support and enthusiasm that enables us to carry out such developments with absolute integrity and confidence. Having said that, we all know that Nakasi is a rapidly growing area within the Suvarnasori corridor, and it has indeed seen gradual increases in population, the development of the last few years, and indeed very timely for the ministry to have a new health center to provide health care to over 25,000 people around this area. This, I'm sure, will also significantly enhance our healthcare services and meet the growing demands of the health services, and it will also enable patients to seek services closer to their homes. And it will now enable smooth flow of services at the Makoi Health Centre as the load will now be shared between the two health facilities. Ladies and gentlemen, the Ministry of Health and the government of the day is committed and strong in its effort to enhance the health service delivery through the following. We are committed to expansion and consolidation of primary healthcare services. We are committed to improving and strengthening continuum of care. We are committed to making health services accessible to communities including women and children, elderly and those with special needs. And of course, the new Nakasi Health Centre has been designed to bring the services closer to all Fijian families. Ladies and gentlemen, the health centre also is designed to provide a wide range of services from integrated management of childhood illnesses to women's health, to emergency services, and of course to special clinics for the treatment of NCDs. With that, ladies and gentlemen, I'd like to thank the following: our Honourable Prime Minister for being here with us this morning and for the inspirational address that he has given to us, and of course sharing with us his government's vision. And I'm sure you will agree with me that under the leadership of Honourable Prime Minister, we have seen many, many developments for the benefit of the people, and I'm sure in the coming years there'll be more such initiatives. I'd also like to thank Voreqe Construction Company for the early works on this site, Cope Construction Limited for the construction of this health centre, the Ministry of Infrastructure Director Building and his team, the architects for the drawing, implementation and monitoring of the works and the facility until completion. I see Dr. Shah there, sorry, Mr. Shah from the Construction Implementation Unit. Mr. Shah, thank you and your team. He's a doctor this morning, PM says. So thank you, the Construction Implementation Unit, for the work that you do in assisting the Ministry of Health in ensuring that projects such as this is completed on a timely basis. I'd also like to thank GMR and Sons Limited for the donation of $300,000 for the purchase of medical equipment and furniture for the health center. The DMO Central and his team for the organization of this event, SDMO Rewa and her team to operationalize the facility. And I'm told that we started the operations Tuesday this week to serve the people of Nakasi and the greater Rewa area. The Ministry of Health and Medical Services headquarters for the effort. My permanent secretary is here. Thank you very much, PS. At this point in time, ladies and gentlemen, I'd also like to acknowledge the hard-working health professionals, our nurses and doctors for the services to our people. And finally, Prime Minister, thank you very much for your leadership and vision for a healthy and prosperous Fiji. So, ladies and gentlemen, here is another chapter completed, which will definitely offer great assistance to the people of Nakasi and the surrounding areas. And at this point in time, if I could also inform you, the Honourable Prime Minister spoke about the new Ba Hospital. 2 days ago, we were handed the keys for a completed new Ba Hospital project, and the people of Ba should be able to see the operations of the new health centre in the coming 6 months. We look forward for that. And I think with these words, ladies and gentlemen, I'd like to thank each one of you for showing your support here in commemorating this wonderful program. And if I can just ask you to put your hands together and thank each one here.
Surrounding areas, we thank the Prime Minister and the Minister for Health and use this facility.
Naka, blessing to everyone that we walk through this door. Nambula, Bulamanaka. You and who is the second one?
Dr. Peter, the one we...
Oh, okay, good, okay.
So this is our consultation rooms for the doctors, the waiting area for the patients here. And she's our staff nurse.
Bula. So from here?
Here we go the emergency.
The special clinic.
Basic support.